while holding it in the position, first we have to make sure that the inferior vena cava, the groove for inferior vena cava, or the inferior vena cava, that should lies vertically on the posterior surface, and this wedge-shaped lever it should lie on the right side. So, while holding in the position, we are only in the right position. This is a model of the lever. The groove for inferior vena cava lies vertically on the posterior surface of the lever. The superior surface is convexo-concavo-convex, such that the convexity on the right side is higher than on the left side. The wedge-shaped base is lies on the right side. The inferior border is directed downward and forward. Now we will go to the surfaces. This is the interior surface of the lever, superior surface of the lever, right lateral surface, posterior surface of the lever, posterior surface. Then this is the visceral surface and border. There are three borders separating the superior and the posterior surface. The superolateral border, separating the posterior and the inferior, the posterior inferior border, and one is the inferior border that will separate the anterior surface from the visceral surface. Now let's see the relations of the posterior surface of the liver. Posterior surface from right to left, this is the bare area of the liver, then the groove for inferior vena cava containing the inferior vena cava, then caudate lobe of the liver. There it will be the esophageal impression of the abdominal part of the esophagus. And on the visceral surface of the liver, from left to the right, gastric impression, which is related to the fundus and the body of the stomach of its fundus and body of the stomach. Then tuber omentally, this part tuber omentally, which is related to the tuber omentally of the pancreas. Then fissure for ligamentum teres hepatis, which lodges the ligamentum teres hepatis, or remnant of the obliterated left umbilical vein. Then porta hepatis. This is the porta hepatis, the gateway of the liver. Okay. Then quartet lobe of the liver. Fossa for the gallbladder, which uses the gallbladder. Then duodenal impression for the superior duodenal flexure, colic impression for the right colic flexure, renal impression for the anterior surface of the middle part of the right kidney, and the suprarenal impression for the right suprarenal gland. Now, its lobes, by the attachment of the falciform ligament anteriorly, fissure for the groove of ligamentum venosum and fissure for ligamentum teres. This is divided into anatomically right and the left lobe, but by a imaginary line passing through the groove for inferior vena cava, then through the fossa for the gallbladder, and anteriorly slightly to the right of the falciform ligament will divide it into the physiological right and left lobe. And each lobe consists of further 4 lobes. Altogether, there are 8 physiological lobes. The first lobe, caudate lobe, it is regarded as the first lobe. The quartet lobe, it is fourth lobe. So it is gone in the we count the physiological lobes in the clockwise direction. So this is the first lobe, anteriorly first lobe, then second lobe, third lobe, the whole part fourth lobe, fifth lobe, sixth lobe, seventh lobe, and the eighth lobe. Posteriorly, first lobe, second lobe, third lobe, fourth lobe, fifth lobe, sixth lobe, seventh lobe, and the eighth lobe. This is the porta hepatis. The porta hepatis contains a branch of the hepatic artery, or right and left hepatic artery, then the common bile duct, and the portal vein. From right to left is the bile duct, artery, and the vein from right to left. And from the as porta hepatis is the gateway of the liver, hepatic artery, portal vein, and the sympathetic or the nerve plexus or the hepatic nerve plexus, they get the entry, and from outward they will come the common bile or hepatic duct, common hepatic duct, then lymphatics, they will come out of the porta hepatis.